We travel to a village called Uvarsad in the Gandhinagar Taluk to understand how the E-Mamta project works, a path-breaking initiative by the Gujarat government that brings in IT and rural healthcare all together. 12 kilometers from Gandhinagar is a quaint village called Uvarsad. And it is here that we are taken by the team from National Rural Health Mission to meet some of the people working on the E-Mamta project. 20-minute drive from the city and we reach the primary health center in Uvarsad. Equipped with 6 beds for patients, a maternity ward, a pharmacy and even a lab for basic tests, primary health centers like these are truly the cornerstone of rural healthcare. Each and every primary health center has a medical officer, Ayush medical officer, a lab technician, staff nurses, a male supervisor, a pune and female health workers, the data collectors for the E-Mamta project. It is a job of these female health workers along with ASHA workers or representatives from the community to travel to the interiors of villages every single day to collect data on women, children and pregnant mothers. Once the data is filled out manually, the step of entering data into the system, an online portal, begins. A painstaking process with no room for error done by data entry operators at primary health centers like this one. Once the information is in, data entry operators head to emamta.gujarat.gov.in, an online portal that can be accessed by anyone from the district health officer to even the chief minister if he must, with a simple login ID and password. The website is simple yet functional and is in the regional language, which is Gujarati, which makes understanding data easier for the operators. In terms of layout, the site has a ticker-like function which works as a great tool to pass on important information and updates to the operators and doctors alike. Once signed in, the website has various tabs. One for reports, which is primarily accessed by senior members at the NRHM and various district level officers. Another for the work plan, which informs the female health workers and doctors at primary health centers of pending follow-up visits like vaccinations and other detailed records. And finally, an SMS tab which allows for bulk messages to be sent to family members reminding them of vaccination appointments. In case of new entries, data entry operators have to be detailed and precise, mentioning the taluka the village falls under, date of birth, religion, caste and even the number of members in each family. To avoid duplication of any sort, the system also generates a unique family number for each member in a family. This number acts as a way of identifying individuals and also helps when searching for details of people within the system. This project is truly an all-rounder.
A lot of change has happened. For the first time, the infant mortality rate of Gujarat declined by 4 points last year. So, a lot of impact has come up through a large number of interventions that have been taken up in the mother and child health sector in Gujarat. And a large number of programs like 108 EMRI, like NICUs and home-based newborn care, IMNCI have gone into improving the IMR of the state. And certainly one shift that we see is now with better data and now with good communication, we are able to reach out to the people as well as to our workforce more effectively, which is very important in any program.
On the same lines as the E-Mamta project in Gujarat, Sashakt is a program that enables rural health workers in the Baramati Taluk